Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Good afternoon, everyone. As of today, we have 3 active cases of COVID-19 in Nova Scotia, all related to travel, and they are isolating as required. As we watch cases increase across Canada, we are grateful that our numbers remain low, but we can't become complacent. We are increasing our testing capacity. Our primary assessment centres will be larger and open longer with increased staffing, so that Nova Scotians with symptoms of COVID-19 will get tested faster. We are increasing our lab capacity to process 2,500 tests a day by mid-November. That means Nova Scotians who are tested for COVID-19 will know sooner if they are carrying the virus. We are also adding equipment in Sydney in early November so the tests won't have to be sent to Halifax to be analyzed and processed. The IWK is doubling its capacity to increase the speed of testing for children. Starting tomorrow, the IWK will pilot a gargle test for children ages 4 to 18. It is more comfortable for children, and if the pilot is successful, we will soon be able to do this at all of our primary assessment centres. Our intention is to have all of this in place by November to be ready for flu season and a potential second wave. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And I'll start by giving an update on our cases here in Nova Scotia. As the Premier said, as of today, we have 3 active cases of COVID-19, one of which remains in the ICU. To date, Nova Scotia has had 1,089 cases of COVID-19, 98,110 people have been tested with negative results, and we've had 65 deaths. Yesterday, Nova Scotia Health Authority's lab completed 482 tests. At our last briefing on September 22nd, we announced 1 new case, and since then we've had 2 additional new positive cases of COVID-19. As the Premier said again, all 3 cases were people who had traveled for various reasons outside of the Atlantic bubble, and all of them were following the requirement to isolate upon return or entering Nova Scotia, and as a result, we've had no further cases resulting from these initial cases, very few close contacts in any of the 3 cases. So our requirements around quarantining work, and people are following those requirements, and that's an important part of our overall strategy. We are increasing our capacity to test Nova Scotians for COVID-19 as quickly as possible. There's a number of steps in place that incrementally by mid-October and then again by mid-November, increasing capacity and decreasing the turnaround time for testing. All of these improvements together will mean faster testing for Nova Scotians. And it's critically important that we do this so we can detect and manage cases quickly. It's all any positive cases, important we know about them and institute public health follow-up rapidly. It's also important so the people who are being tested negative because they've had COVID-like symptoms, they need to get a result back quickly as well, so they can get out of quarantine and get back to school and work as soon as they safely can. So along with these enhancements in our testing strategy, we all need to continue our vigilance to limit the ability for COVID-19 to spread in our communities and to protect our schools, our health system, and our long-term care facilities. It's that combination of border measures, access to testing and rapid public health follow-up, and all the public health restrictions and requirements, and everybody practicing those, which will continue to keep us safe. I'm hearing people recently saying that we are so COVID safe within the Atlantic bubble and within Nova Scotia, and they're asking, why can't we relax some of our restrictions? But we have to remember that it's because of these restrictions, as I said, the border measures, the testing and follow-up, and everybody practicing the public health measures that allowed us to be as safe as we are today, and it's what will allow us to be safe in the weeks and months ahead. Those are our prevention tools, and we need to maintain those. As I said, the border restrictions remain important, that requiring for the majority of people 14 days of self-isolation coming in Nova Scotia. We've seen the value of that over the last few months, that we've had most of our cases have been isolating, and because of that, we've had minimal spread from those cases. But the border restrictions alone won't fully protect our communities. We can't abandon physical distancing, increase gathering limits, forget about hand hygiene, and move away from wearing masks in indoor places. If we did that, then any imported case of COVID-19 would have a much greater potential to spread very quickly, because our communities are necessarily open, because our businesses are necessarily open. If we get COVID into our communities and people aren't following all the measures, that's the situation where we could get widespread. And we want to keep our businesses, we need to keep open as much as possible. We need to keep our schools open as much as possible. But how we keep them safe is everybody doing what they need to do, working together. So now is not the time to be relaxing and becoming complacent about COVID. We're seeing the second wave in other parts of the country, and that second wave is worse, because the challenges of controlling large numbers of COVID while keeping things open as much as possible. Dr. Watson-Creed and myself have had conversations with our colleagues in Ontario especially, and they're emphasizing that point. It's much easier to control COVID if you have everything locked down. And they may have to go there in some of those other parts of Canada. We're trying to avoid being in that situation in the first place. We also have to remember that while much of the recent resurgence has been in younger adults, what we're seeing now is increasing case numbers in other parts of the country in older ages. This is inevitable, because as COVID becomes, or if it becomes widespread, it will move and affect all age groups. And this really shows why we need to think about others and be COVID safe ourselves. No matter if we think that our age, we're at a certain age and our health is good, that we're not at risk ourselves, we are potentially putting others who are at risk if we're not considering and putting their needs ahead of our needs in terms of us keeping collectively COVID safe. As I said, if we've talked to our colleagues in other jurisdictions, they're becoming overwhelmed in public health. Their healthcare colleagues are becoming overwhelmed. If you talk to people in Ontario, they've had so many cases that they've now stopped contact tracing in public health. The hospitals are full, and the ability to deliver non-COVID care is becoming increasingly difficult. So we need to do everything we can in Nova Scotia to avoid this type of situation. We need to stick with our COVID response and continue to follow the public health rules and recommendations. We need to keep putting each other and those who are most vulnerable before ourselves. I do understand that some businesses are hurting, that we are always trying to keep them open as much as possible and continuing to have communication with them. But they have to understand they're part of a bigger piece, and that we have to accept that there are going to need to be ongoing restrictions which will have impacts on certain types of businesses. But that is the reality of living with COVID. We'll continue to work with those businesses to be as creative as possible, but we have to allow them to be COVID safe. If we don't, then we run the very real risk of them having to close completely and having no business whatsoever. So my argument to them is that you're better to be able to operate in a limited manner than not operate at all. But I can't say this enough, we can't put Nova Scotia and Nova Scotians at risk of exponential spread of COVID-19 like we are seeing in other parts of the country, especially the big urban centers. So again, I ask all Nova Scotians to remember this. And the need to keep each other safe. Every time they're washing their hands, every time they're taking a step back to maintain the physical distance, every time they put their mask on before they go in an indoor public place, every time they say, well, I can only get together with up to 10 people. What they're doing is showing how much they care about fellow Nova Scotians, especially those who are most vulnerable. So I'd like to talk a little bit about how that all now applies with Thanksgiving, because this week, Thanksgiving weekend is approaching. And I think when I thought about this last night, I was thinking, what am I thankful for this year? It's really the caring and cooperation that Nova Scotians have shown so far to follow the public health rules and the guidance for our collective good, for the good of our communities, and how Nova Scotians have continued to look for ways to adapt to this unprecedented and challenging situation by making Nova Scotia different, but better at the same time. I do know that for a lot of us, Thanksgiving dinners are going to have to look different than they have been in the past. If you're used to having big extended family meals, then this year's celebration has to be much smaller. Our current requirement remains that no more than 10 people can be in a close social group together without physically distancing. So you're going to have to find ways to have small groups having Thanksgiving dinner together. And if that means a large family has to divide up and have different groups, having different meals, I regret that that's going to be necessary. But we can't kind of relax the rules just for Thanksgiving, because we may well see that the impact of this in 2 to 3 weeks if we're not careful. So for many of us, that means in our immediate family that we can get together, or for people who have small families or maybe not have families locally, getting together with a small group of their close social group that they've been getting together with over the last several months. But it's critically important that we keep our numbers small, and this is going to be a consistent theme when I come back to talk to you about Halloween parties or Christmas, or that keeping our social gatherings small and safe is critically important in the coming weeks and months. So here's a few tips for making your Thanksgiving COVID safe. That it's important that as you're preparing, if you're the one preparing your house to receive people and cooking, regularly cleaning, as always, food safety is important, so cleaning and being careful in the kitchen, but also extra cleaning around the house of high-touch surfaces, doorknobs, faucets, etc., those kind of things where lots of hands are going to go. If you're not feeling well, even at the last minute, don't host the dinner. If you're not well, then you should not be hosting the dinner. You should not be going to a dinner because you may have COVID. It's important that you stay away if you're unwell, as unfortunate as that may be. It's also important that people who are meant to be self-isolating, whether because they're recently here in Atlantic Canada, or maybe they're being identified as a close contact, or they're waiting for a test result, self-isolation means self-isolation. It means not going to Thanksgiving dinner this weekend if you're in that category. It's one of the ways that one of the things we have to do to keep each other safe and put others ahead of ourselves. As difficult as that may be for some folks, I recognize those challenges. So maybe we need to work together. People who are self-isolating, maybe then somebody in the family has to take them a plate of dinner, drop it off, whatever. Also think carefully about the age and the health of people that will be invited. And so people who are older, people with underlying chronic health conditions, maybe they're the ones who we don't want to bring in even a gathering of 10, or if they do come, being extra careful about how people interact with them. So thinking about the risks of individual people as well. When it actually comes to the meal, it's important that we don't have kind of buffet-style service with lots of hands each touching the same serving utensils. So we would ask that if you are have one person designated as a server serving out individual plates and then passing those plates around, rather than passing around bowls and platters where lots of hands go on those. And again, just a reminder that people who are travel, if they are planning on traveling outside the Atlantic Canada for Thanksgiving, we would not recommend that. We're asking people, including our university students, stay within the Atlantic bubble for Thanksgiving. But if you do travel, you are going to have to isolate for 14 days when you get back. I just want to talk for a couple of minutes, ending about our post-secondary students, many of them who have come here to learn through the fall and winter and spring. They're here as part of Nova Scotia. Many of them, we're asking them not to go home. So we're saying to them, my communication colleagues have come up with the term Friendsgiving. So we're asking them to get together in creative ways, in small groups. You can't go home for Thanksgiving. Maybe there's 4 or 5 other of your fellow students students who can't also go home. So get together and celebrate Thanksgiving together, maybe start a new tradition. We also have to remember that outside is much safer than inside. So for everybody, if you're celebrating Thanksgiving, if it's nice enough, maybe you can even eat outside, but at the very least, get outside and spend part of your time outside where it's safer and get some physical activity at the same time. So I do want to wish everybody a happy Thanksgiving, but also a safe Thanksgiving. There are more holidays coming up. We'll be coming back with more information, more detailed information, first with how to do Halloween safely if you choose that, and as we get into further down the road with other holidays coming. But it's important that these important times in our calendar that we actually observe them, but it's important that we're going to observe them in a socially safe manner this year. And there is lots more information on Thanksgiving on our coronavirus website. Premier.
Are you going to cook the turkey?
Some people call me the turkey.
Are you going to cook it this year?
I don't know. We haven't made that decision yet.
Probably the year to do it. I think I might do it this year because fewer people complain if it doesn't work out right.
That's a good point.
You see? Over to you, Chrissy.
Just a reminder, we'll do one question and one follow-up for those reporters in the room and on the phone in the amount of time that we have for today. First question goes to Chris Halef with News 95.7.
Thank you. This question's for Dr. Strang. The Plastic Bags Reduction Act is supposed to take effect later this month, and we've been told by the Department of Environment that they're seeking your office's direction on the matter. Can you say now whether or not it will go ahead as planned?
I've given my perspective to environment that there's nothing from a COVID reason that would require them to delay that. But I've also given a perspective that if from the retail sector, that because of all the impacts of COVID, that they were hearing that there was a need they would a need to kind of not put another burden, and we could delay that. I've given them both those perspectives. I don't know when they're going to make a public announcement on that.
It will proceed as scheduled. Yeah.
Christian, follow-up?
Yeah, a question on behalf of a colleague, actually. We have heard some concern from employers expressing concern about their employees living in the same space as somebody who is self-isolating because of travel outside the Atlantic bubble. I'm just wondering if you can maybe talk a little bit about is it safe for people to live together if not all individuals are self-isolating, and what tips you can give to those people, perhaps?
So we recognize that for some people, that in an ideal situation when you're isolating, you're on your own. But for some individuals, that's just not possible. And so we've said, for instance, rotational workers who come back, travel back and forth, they can be in their home. They need to be with their families. And other people coming back for the 14-day, they may have nowhere else to be other than with, in a home with other people. So we've given them guidance in that they should try to stay isolated as much as possible, even within that home. And if at all possible, separate bathroom and keeping it apart as much as possible. Wearing masks if they need to around other people, being careful about their hand washing. So it's about recognizing that we have to understand. Again, so much of COVID comes back to balance. We'd like people to quarantine, but we have to find a reasonable balance. And as long as they're well, the other people in their household, aren't at great risk and can go about their work or other activities as normal.
Next question will go to CBC's Mike Gorman.
Dr. Strang, you said you're going to need more people to increase capacity and the expansion coming in Cape Breton. How many people do you need, and where are they going to come from?
So that's a number. I don't have an exact number. NSHA is looking at a number of possibilities in terms of expanding the type of people that can actually do a swab. So we started off, it was only nurses, and now we're gone far beyond that, the type of people who could actually do a swab. They're looking at how they redeploy people. In the lab, for instance, Cape Breton, it's more about having the piece of equipment there than the number of people. The lab here in Halifax is actually months ago went to a 24/7 schedule within their existing staffing model. But the specific details about exactly what type of people and the numbers we'd have to get for you from NSHA.
I may end up in the same place, Premier, but I'll ask it anyway. Do you anticipate these expansions are going to cost additional money, or is this stuff that you think can be done within the existing health department's budget, or coming from funding that you've already received, perhaps from Ottawa or something like that?
So part of the funding that was coming from the national government was around increasing the testing model. That would be part of that. Some of it is actually simply, as Dr. Strang just said a few minutes ago, restructuring current workforce that we have. But it'll certainly require new funding, but that funding has been accounted for through the national programs and some of our own budgets.
Next question will go to Paul Legier with Radio Canada.
Yes, this question is for Dr. Strang. I've been to the gym more than once in the past week, and I've seen in the space of an hour about a dozen people walking around without masks that aren't exercising. I've been to a big box hardware store where at least half, if not more, people are not social distancing, and I went to a big recreational facility where by the end of the day, most people are not wearing masks. So obviously, not all Nova Scotians are caring and cooperating with the health protocols. And what I'm hearing more and more is we're in the bubble. We have so few cases. The public health authorities' advice and protocols is overkill. I'd like a reaction to this sort of behavior that I seem to be seeing quite easily in Nova Scotia.
So we're aware of that and kind of the concept around mask fatigue and just general, COVID, relaxation. And, that's why I continue to say what I need to say every chance I get. We're doing a bunch of work on social media trying to get that message out. I think all people need to do is look around. Look at Ontario, look at Toronto, Ottawa, Montreal, in Quebec. We don't want to be there. And once you get widespread COVID, it's very difficult to stop the spread. You can't put the genie back in the bottle. So that's why we need to keep pushing the message that all of us need to do what we can do now. We do have, the ability, people who have a valid medical reason to say you don't need to wear a mask, well, they don't need to wear a mask. We have made some exceptions, like for instance, people at a gym, if you're doing a physical activity and can't wear a mask, you can take a mask off for that, but put it on once you're done. So we need everybody to understand it's not about themselves, it's not about what they feel they feel comfortable doing or not. Because the person beside you, when you're not wearing a mask, maybe the person has an underlying immune disorder that we don't even know about, and we're putting them at significant risk. Maybe it's the healthcare worker that we're putting at risk, who maybe the healthcare worker that we need to look after us next week. So we need to think about others first. And doing all this, as I said earlier, let's keep ourselves safe. Let's follow the requirements, the public health rules, as well as all the other recommendations around hand washing, staying home if you're well, because that's what will allow us, if COVID gets here, those are our tools that will minimize the chance for widespread. Once it's here and it's spreading, it's too late to all of a sudden say, oh, now we need to be strong and protect ourselves. So it's critically important that we don't become relaxed, that we can, and I recognize the challenges, but I can't say it strongly enough, that we need to keep doing what we've been doing for the last 8 to 9 months for at least a couple more months as we see what happens with the second wave in central Canada. We cannot put ourselves at risk by becoming relaxed.
Follow-up?
Yeah, without businesses having sufficient resources to take care of enforcing protocols like social distancing or wearing masks, do you think that your constant urging to the public is enough to stop the behavior that is easily seen, or at least that I easily see?
Well, I think the vast majority of Nova Scotians have been and continue to do what's necessary. We don't need a huge enforcement approach to this, I don't believe. Many businesses have done a wonderful job of setting up with signs, how they structure the flow of people that just maintains physical distancing, and people don't really even need to worry too much about it. They just need to follow the instructions in the store. So there are ways to do this, in many ways, to run a business that doesn't require a huge enforcement component. The masking ultimately relies on people doing the right thing. But we've certainly observed the majority of Nova Scotians up to date have been doing what's necessary. I am concerned that there is, as you pointed out, some of what I call this masking fatigue, and that's why we need to continue to remind people that we can't become complacent, because by doing that is how we then end up in a much higher risk situation where we may then have to shut things down, put much greater impositions on all of our lives, and none of us want that.
Next question will go to Nibal Snam with the Herald.
Dr. Strang, can you speak a little more about the benefits of the gargle test? Why are we using that test now as opposed to PCR?
No, it's just a little different way of collecting the sample. It still goes for a PCR test. So it's just, rather than the swab in the nose, it's just a gargle test. And it's been validated in BC, and we've done our own work here, and this is what the pilot project will still do, making sure we're matching that up in some ways. Some kids will still get a swab and comparing it, that is still a valid test. What it does is for some young kids, and it's been validated. The only reason we're doing it up to 18 is because that's the age group that BC was the leader in this and has done the validation work so far. At some point, we may be able to have adults do it. If for some people, it's just a more comfortable test. But there are some kids who actually can't gargle and spit for a number of reasons, developmental issues or other challenges. And so we're going to have both available, the swab as well as the gargle.
Nibal, do you have a follow-up?
What are your thoughts on the new online assessment tool? Has it actually alleviated the pressure on the 811 line?
So it's too early to tell. It's just getting implemented. But certainly the whole purpose of that is to have people go through the screening process themselves with the right questions being asked and the right information, that if people have certain types of symptoms or a certain level of severity of symptoms, that they are then clearly told they need to call 811, because we don't want to miss people from a clinical perspective. But we've got a lot of experience with this. Other jurisdictions have done this and done this safely. So what it will do is allow people to get through the screening process and get to the point where they need to book a test without having to talk to anybody. And that will greatly, people won't have to wait to get to get through on the phone line to 811. So it's the first step in reducing the turnaround time. We're actively working on, in the short term, having more people answering or calls to book an appointment, and we're actively working on having ultimately people can do an online screening, and if they get told they need to have a test, they can then take the next step and book their own appointment. We're not quite there yet on that. So ultimately people will be able to get all the way through to booking an appointment without having to talk to a person. They will always have the option to talk to a person if they need to. So that will greatly streamline our whole process.
Next question will go to Global's Elizabeth McSheffrey.
Dr. Strang, we've heard there are rumors inside a local high school here that, some people are going to travel outside the Atlantic bubble for Thanksgiving, prompting the school just to send out a letter to parents, saying if you're aware of families that have traveled outside the bubble and their kids aren't isolating and have returned to school, to contact the school and just make them aware that those students aren't isolating. I wonder if you feel that's the right approach, or what your comment is generally on that.
So I think that's a reasonable approach from the school if they're actually hearing that, and they're not saying it's true. But if we have to work with each other, and if schools need to pass that information on to families, to just say be on the lookout. And I don't think it's inappropriate, because if there is a family that is deliberately putting the rest of us at risk by traveling and not self-isolating, to me it's perfectly okay that other people in the right way approach the school and say, you know what, these kids have traveled. They need to be isolating. They shouldn't be in school. I think that's perfectly reasonable for other parents to say, why should their kids and therefore their whole family be put at risk because other people are deliberately disobeying rules? In an ideal world, we wouldn't have to do that, but I think the vast majority of people are doing the right thing. But we also need to have mechanism to hold everybody accountable as well.
And this question's for the Premier with regards to the leadership contest. There's just a few days left now for candidates to announce. Obviously, we don't have very many candidates at this point, and perhaps not the diversity that the party might have been looking for. I just wonder, what your comment is on the diversity in the candidates that we're seeing, whether it meets your expectations or what you hoped, to have presented to the public for the party.
Well, I was elected Premier on October 8th, 2013. One of my goals was that Nova Scotians saw themselves more reflected in the important institutions. I had the good fortune of being elected with more women than any Premier in the history of our province. I've appointed more women to the Executive Council than any Premier in the history of our province. I have gender parity on the family court bench, more diverse than it's ever been. The senior team inside of government is more women than men at the Deputy Minister's table. Important people in my office, carrying whether it's the Chief of Staff, Director of Communications, all women. The issue around diversity and gender equality in the leadership is a better question for the party.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. Regarding testing capacity and looking at that nasal swab test, as you mentioned, Dr. Strang, we've seen success with that in British Columbia. How does the gargle test compare to the nasal swab in terms of efficacy and cost and the speed of use?
So it's easier to use because of it. And because of the ease, it allows I think a greater diversity of healthcare providers. I mean, ultimately, it's the individual who gargles then spits. So, but it still needs to be supervised and done in a healthcare setting. But a greater number of people can actually do that. So that's an advantage. My understanding from the lab is it's shown well that it is in the same level of accuracy and the same reliability as a nasal swab. That's the reason we're adopting it. And if things go well with this pilot project, we're certainly looking to then move it and use it in other of our primary assessment centers as well.
Go ahead with your follow-up, Lindsay.
And looking to ramping up to 2,500 tests a day, as you mentioned in Mike's question about staffing levels and things like that. Hope to know that soon. But I'm curious about that equipment you mentioned in Cape Breton at that lab. Can you tell me about that there and the cost of creating lab equipment to make testing possible there?
So it's my understanding it's the same piece of equipment that we actually have in the lab here in Halifax. What it will do is allow, I think it's up to 400 tests a day to be done through there. So rather than having all the specimens taken in Cape Breton, it will actually take all the specimens from Eastern Zone, ship to the Cape Breton Regional and do them there rather than having, and certainly in the local Cape Breton area, greatly reduce the transportation time. And it's just adds another 400 tests to our overall capacity. I don't know the exact cost, but it's certainly part of what the federal restart money is paying for. In terms of, a lot of, as the Premier said, a lot of what we're adding to increase capacity is through that federal restart money.
And I think it's important that as we continue to ramp up, you're seeing our numbers. We want to make sure we have capacity for Nova Scotians, but if we have excess capacity, we will make that available to sister provinces to deal with issues as well. This is a Canadian issue, and we as part of the Federation will do our part. And I would say provincially and nationally, regardless of political stripes, all of the governments have been cooperating and working side by side to support one another, whether for whatever form. And this is just the next phase of working with the national government to increase the number of testing opportunities in our province. And if they're not needed here, we'll certainly make them available to the rest of the country.
We'll now go to the phones. Next question will go to Keith Doucette with the Canadian Press.
Good afternoon, Premier. I'm wondering, we're well into October now, and based on what you've been telling us during this news conference, whether it's a reasonable expectation to assume that we will not see an opening of the Atlantic bubble during this calendar year, and likely not in the winter months either, that it's probably be next spring before we see anything like that. What can you tell us about that?
I don't know if I could say that for certain. I can tell you it won't be in the short term. Obviously, like Dr. Strang, working with Dr. Strang in public health, I'm certainly concerned with what I'm seeing in parts of the country, the large outbreak, but we'll be watching it, but it won't be anytime soon for sure.
Go ahead with your follow-up, Keith.
Yes, for Dr. Strang, I'm just wondering about, you mentioned university students and having to self-isolate. When they first came back to open up school, they were also subject to a testing regime. Will they have to undergo the testing regime yet again if they go away?
So right now, we're working with the universities to limit the number of students who go away, and because the reason we did the testing, because we had a large number of students all at once, and we had a number of measures, none of which was perfect, but when we put them all together, we had a very safe program. We're comfortable now that any students who go away, and even any international students who may come, that the numbers are going to be much, much smaller. They're all going to have to stick with their 14-day quarantine period, but we're looking at using our testing capacity in other ways rather than the small numbers of students. We don't believe it's necessary. They can stick with the 14-day quarantine period. We're still in conversation with universities, and when we get to talking about Christmas holidays and then students coming back, we need to talk about what role potentially does testing play in that, knowing that we may be in the winter months and there may be a lot of demands on our testing. But that's a number of months away. You know, I've said to the universities, we can revisit the discussion around what after Christmas looks like as we get into November, because we'll be in a very different position with our epidemiology, whether it's within Nova Scotia or in other parts of the country.
Next question will go to Heidi with CTV.
Hi, this question is for Dr. Strang. What is the difficulty activating the COVID-19 alert app to this point? I know the Prime Minister had said it would be available soon in Nova Scotia, and just wondering if there's an update on that.
So I don't have a final date, but or an exact date, but we're in the final steps of working out, some of the legal and privacy issues. But we're very close to actually having that go live here in Nova Scotia.
Heidi, go ahead with your follow-up.
Thanks. Also for Dr. Strang, there was a flight that came from Toronto and went through Halifax and then went to Newfoundland, and a lot of passengers connected with that Air Canada flight on September 30th have been notified through the government of Newfoundland, but Nova Scotia didn't say anything about that. What's the reason for that, considering that the plane did stop in Newfoundland?
So the public health protocol is actually the receiving province. So the flight ended in Deer Lake. So it's the receiving province, Newfoundland, that when they become aware of a case, that they have to do the notification for passengers, even if it's a multi-stage flight that do that. I have, however, asked my team, I had a conversation this morning with my team to look at, even though it's Newfoundland's responsibility, to look at when we're notified of a flight like that, there may have been people getting off in Halifax, that even though that we look at how we might also be part of that notification process as well. But again, it's the end destination jurisdiction that has, within public health, our protocols, that has the responsibility to do that wide media announcement of possible exposure.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. 2,500 tests a day is a very big improvement. I think the previous highest was around 1,200. Way back in the middle of, or the beginning of summer, you had suggested that with increased testing, you might move to doing some randomized workplace testing and just cross-population testing of people who were healthy or who were asymptomatic. Is that on the table?
So it is on the table. We were those discussions. We moved those into the priority in the end of the summer was to do our large university cohort, which we've talked about. We're now in the process. Our priority is now increasing access to make sure anybody who has symptoms gets very timely access and gets a quick turnaround, so we can do the appropriate public health follow-up, or if they can be released from their quarantine period. But once we get these implemented, and we have where our next step is to look at not just for the general public, we wouldn't go there because there's a lot more evidence now around just asymptomatic testing for the general public is not a good use of resources. But we are having conversations about other specific places, work sites or other populations where we might use testing of people who are asymptomatic. It may play a role moving forward with our borders. for example. The other piece of this is that where I'm involved in active conversations now around some of these point-of-care tests, which have now been licensed by Health Canada. I was on a call just before I came here about how the federal government is procuring those, how they're going to be distributed to the provinces. We're having a conversation now in Nova Scotia. We have to validate those in our lab, but how we might use those as part of our testing strategy as well once we get them validated. And they could certainly play a role in some of these site-specific or population-specific, screening, if you will, of people without symptoms.
Tim, do you have a follow-up?
I do. I guess I listened to this press conference and see the conversations happening across Atlantic Canada, and it all seems rather reasonable. And then I turn on my TV and I see the President of the United States saying frightening things, and I wonder, first of all, if you have concerns that some of that inappropriate messaging will affect people here, and if you have a general comment at all about what Donald Trump is doing.
So I have my own thoughts about that. I'll keep them to myself. But in general, I think we need to be, it's a reflection of how a serious situation the U.S. is and why, as Canadians, we need to keep very strong border measures and be very careful about how people from the U.S. actually come into Canada, because they're coming from a very, a country where there's areas of substantive risk. I am concerned because some of the messaging around the anti-mask sentiment, etc., people are going online, and they're fortunately small, but there is some of that sentiment here in Nova Scotia and across the country. So we have to be aware of that, and that there are people that are getting their information from less than valid sites, and that's why we need to continue to encourage people to go to get your information from an accurate site. Don't get it from a Facebook page. Frankly, don't listen to what you hear on social media is probably a pretty good rule for anything. Go to an accurate site. So for coronavirus, we have our coronavirus provincial website. Public Health Agency of Canada has a good site, which then links to the World Health Organization, CDC Atlanta. Get your information from credible sources.
Next question will go to Jean Laroche with CBC.
Hi there. I just wondered, this ramping up of testing was not unexpected, but Premier, why wasn't this kind of ramp up ready for the start of school?
Well, we had felt all along that we were having capacity within our system, as it took time to ensure that we had the staff to be able to do it. And as Dr. Strang would have had, we needed equipment as well to go to the Eastern Zone. So this has been the continued part of the process. And when we finished the Safe Restart program with the national government, we focused on the things where we thought would help us to continue to control the virus. And if there was an outbreak in a particular part of our province, we could rapidly do those testing without shutting down the entire province if we could isolate it, and this is the next phase of that process.
Jean, do you have a follow-up?
Yeah, I just want something, Premier, you said, and it was a little off mic, so I want to be clear that, I want to be sure that I heard you properly. Plastic bag ban or plastic ban is going ahead as planned at the end of the month, and could you tell me if I heard you correctly, and why?
You heard me correctly?
That's all the time we have for questions today.
Thank you, Christine. As Dr. Strang said, and I want to wish all of you a happy Thanksgiving weekend, and I want to tell you how thankful I am to Nova Scotians for helping us to keep our numbers low. That is not the case everywhere in Canada. We're watching case numbers climb daily, and it happens fast, and it's hard to control after it takes place. We don't want that to happen here, and if you think it can't, think again. I'm not trying to scare anyone, but we have to stay vigilant. And we know the best way to keep our numbers down and protect each other is to continue to follow the public health protocols. Keep your distance, wash your hands, and continue to wear your mask in public places indoors. Remember, this is mandatory and has been for months now. I am worried, as was alluded to in this press conference, about mask fatigue and how it's setting in our province. And people are forgetting to keep their distance. We cannot let our guard down. COVID is relentless, and it thrives, quite frankly, on ignorance and arrogance. and there's no reason for anyone to be ignorant of this disease we've now been dealing with for 8 months, and these public health protocols are in front of us, and arrogance is not a way Nova Scotians react to anything. And all of us indeed need to find and continue to work to keep this away. We need to stay strong and continue our daily routine as we have for months, because it's working. This weekend, as you gather to help celebrate, look around the room. Be thankful you're able to be with your loved ones, and think of those who can't. Take a moment to remember those we've lost, and remind each other that love and kindness matters. Happy Thanksgiving.